Hi, good afternoon, everybody. I'd like to welcome you to today's monthly November meeting of the San Francisco Tech Council. My name is Andrew Broderick, and together with my colleague Carla Sumala, we are project co-directors for the San Francisco Tech Council. And that means we are the primary contacts for anything related to the daily activities of the Tech Council. And so please do feel free to reach out to us directly if you have questions or want additional information. I will put our contact information in the chat box. And just a quick introduction for those of you who are new to the Tech Council. We are a multi-sector initiative by bringing government, business, nonprofit, and consumer collaboration to advance digital inclusion here in San Francisco for seniors and adults with disabilities. And we were launched in 2015, and our mission is driven by this core belief that the most effective way to address all the complexities of connecting San Franciscans requires sectors working together and in partnership to do that. And so the Tech Council does serve as that community table around which all the different sectoral partners sit and discuss and explore opportunities for partnership. And that brings us to today's agenda, where I'm going to hand over to Anne Hinton, who serves on our steering committee and has been a long-time member since the early days of the Tech Council, and she will facilitate today's session. So Anne, over to you.
Thanks, Andrew. So as you can see from the agenda's title, Advancing Health Equity Through Digital Inclusion, the council itself has been very focused for the last, since COVID, but before that as well, on how to pull together these different arenas, right? Technology, health, and how to make things like health, although we have interests in other areas as well, but certainly how do you make healthcare accessible to people who are now in the situation with COVID. Brittney Doyle is our next panelist here, and she's the founder of Wise Health. And so I think, Brittney, you come at a particularly good time into this conversation because your work has been on developing strategies designed to address the barriers that are associated with inequities found in underserved communities. And you are also, if I've got this right, you are with UCSF's Black Health Initiative. So you have this ability, I think, to work in multiple worlds, and one of them really is in that health world. And I think we are really looking forward to your presentation, especially as it comes in the context of today's conversation. So Brittney, nice to see you again.
Good to see you as well.
Yeah, good to see you, and go right ahead.
Once again, I'm Wise Health, Brittney Doyle, the founder of Wise Health. We are a public health consulting company that develops engagement programs and strategies to increase impact in underserved, hard to reach, and isolated communities. Actually in here, there was a couple questions that was posed, and the presentation is based around some questions that was given to me. So prior to COVID, Wise Health developed engagement activities in senior housing sites, community centers, schools, and churches. I personally did a lot of guest lecturing, public speaking on developing effective community engagement models and other topics around community engagement. I also held a tech fair last year, and I also conduct other innovative educational experiences that touch on different topics around like senior sexual health and overall wellness. The impact that I saw in the senior community, just general across the board, was decreased access to food, specifically healthy food, decreased access to transportation, pre-existing health conditions going unmanaged, and increased social isolation. In response to that, I developed Bathe with Love, which was a free weekly delivery of a fresh organic health kit, companion calls, and medication pickup. This engagement effort reached over 200 isolated seniors TAY, which is transitional age youth, and hotel sheltering individuals. I don't know if you all know, but a lot of the homeless shelters shut down, and a lot of the people in the shelters were transitioned to hotels. And it was also an issue getting people living in hotels having access to healthy food as well. This effort engaged 18 community and small business partners. We had people from all over the city that donated high-end items, art projects, PPE, food, money. It was consistent love that we received from all over the city. We had over 60 engaged volunteers that did companion calls, came and packed the bags for us, or served as delivery drivers. And our services expanded into the Bayview Western Addition and the OMI, Ocean View, Merced, Ingleside, we call it Lakeview, community. And the effort was designed to increase access to healthy foods through our organic produce, fresh vegetables and fruits, our health education with our healthy kit, our weekly healthy kit that went into the bag, and it had recipes that correlated with the food that we were delivering, brain games, health education, physical activity moves that people could do at home. Physical activity moves that people could do at home. And then through, we addressed social connectedness because we had an assigned delivery driver that was at their door every single day. Well, not every day, I'm sorry. Well, some people every day, but once a week. And so they were used to seeing that. And I know that other people have spoke about that as well, how, they're used to seeing that same person, and a lot of people find comfort in that. So towards the end of this initiative, it went on for about 6 months. Eventually our volunteers got tired, they got a little burned out. People wanted to take vacations. People were going back to school, going back to work. So we had to come up with a solution on how we can keep the effort going. And so we developed a relationship with a nonprofit that connected us with Uber Eats. And the goal of our partnerships with Uber Eats was to increase access to healthy foods, increase the efficiency of our delivery model, increase our reach to new participants, because with this partnership, it was, pretty much endless amount of drivers. So we could access people that we never thought that, we could actually get access to before. It helped us with phasing out our volunteers, who we were very grateful for. It increased access for program participants. It helped, the seniors that participate in the program. It still worked to increase access to healthy foods. And it also exposed them to a new method of delivery. Some people were already used to getting their medications delivered, but here was like a new mode for many people of getting like food and being able to trust the process. So I'm just going to go straight to the barriers and why, and talk about the barriers to the success of this partnership. Because there were a lot of lessons learned. I think we tried out this partnership for 1 month. And even in that 1 month, it was a lot of things that I just didn't have the capacity to fix myself. For one, the partnership was not rooted in complete understanding of community and the fundamentals of community engagement. I had one vision. They were all about numbers. Their vision was completely different. So it just even the foundation, it just didn't match. A lot of the drivers feared being in an African-American community. We had drivers that came from other countries and they had never seen so many Black people, and they would pull up and be like, oh no, the Black people, and it was just too much for them. Several of our bags were stolen, and of course I can understand that because they were organic fruits and vegetables and they were beautiful, so they never made it to the seniors. And if they did make it, they were left in inaccessible places. Like if the seniors were on the 3rd floor, they weren't going up the stairs to take the bags to their floor. They were leaving it by the door outside, or, places where they could be stolen, or places where if a senior was bedbound, or just couldn't get out their front door, they couldn't get to the bags. Language was a barrier. At one point, we had to print out like a little letter to the drivers and be like, look, you're delivering to seniors. Please treat these people like they are your family. Take it to the door. We had to give step-by-step instructions on what to do. I don't know if you can see, but this is her right here, like making it as plain as possible. Please, take it to the door, treat these people with kindness. There was issues with botching the delivery times. They would have the delivery drivers coming at 10 a.m. when our volunteers are just showing up to pack. So that right there was an issue in itself. And most of all, and I have it highlighted, the most important thing I felt was it diminished the social interaction, which was needed by the seniors. Like they needed to see people, their person. They needed to we had seniors that would dress up, put on lipstick just for the delivery driver. They were looking forward to this. And even though we had told them over and over, we gave them enough advance notice that your driver was leaving, we're trying a new model with Uber Eats, it just didn't mesh well. And then, in partnerships, there was no quality interaction provided on behalf of the partner. And, when you're dealing with partnerships, we both everybody has to come with their top game, when we're coming together. So through this experience and just what I've learned over the past year is that, we have to look at how we engage our seniors, how we engage our communities, how we're going to address, health inequities, because we're going to have to get innovative. If I've been hearing the other women speak about, the need for technology education. I mean, that's just flat out across the board. Like our community, our African-American communities are not equipped to handle post-COVID-19 realities, whatever that looks like, whatever we shape that into, there has to be, some sort of emphasis looking at the African-American community and how we can, move our community forward, especially, around technology. Increase access to telehealth. And I really enjoyed hearing what Renika was saying about the GrandPad. I think that was absolutely needed. And if, there could be something embedded in housing sites or, distributed out to the homes, what it seems like George Davis is already doing, or designating a location at a community center, which once again, George Davis is doing, and maybe, getting that same concept in other communities. Increase community responsiveness training among app-based delivery drivers. I don't know if that is far-fetched, but if it can be mandated for new hires, then I definitely think that should be done, because once again, these app-based delivery drivers are going to be coming into the neighborhoods. They're eventually going to be serving seniors and, serving people that they may not have been served before, and they should be ready as well. And then increase awareness and education around useful tech tools and services that can be beneficial to the communities that we serve, increasing that gap of, digital inequity, and looking at how we can increase the access in African-American communities. I know that many of you all, I've spoken to you all before about, my learned lessons from the tech fair that I had last year, and how, it was hard to get companies to want to come and engage the African-American community. I reached out to 200 and I probably got 10. So, having that awareness and education around that. And that's all I have for you. And hopefully when we ask questions, I'll be able to talk about, UCSF's program and learning journeys.
So I have just a couple of follow-up questions, and then we'll move to the larger group. Did the participants need to download the Uber app?
No, so they did not have to download it. It was something that we ran.
You pre-arranged that?
We had to go in and manually put in the addresses and botch them with the times. And so it was definitely more of a experience for me as well.
Yeah. And how were the folks chosen to participate?
So we actually partnered with clinics, housing sites, senior centers. I worked with 3 senior centers, and there was all referrals from programs that had to shut down, but they still wanted to make sure that their participants had access.
Great, thank you.